Most people believe ibuprofen is safe. After all, you can buy it without a prescription at any pharmacy or grocery store. It's on the shelf next to aspirin and Tylenol. How dangerous could it be? I want to tell you about Richard. 63 years old, retired plumber, active, played tennis twice a week, took 3 ibuprofen tablets every morning for his knee pain. His doctor knew. Nobody said stop. Richard felt fine. His knee felt better. He kept his tennis schedule. And then one Tuesday morning, he woke up and couldn't catch his breath. His wife drove him to the emergency room. By the time I saw him in the ICU, his heart was failing. Not from a heart attack, from the painkiller he thought was keeping him active. Here's what nobody told Richard. What I'm going to tell you today. My name is Dr. Michael Hartman. I'm a cardiothoracic surgeon with 32 years in the operating room. I've opened over 2,000 chests in my career. I've held beating hearts in my hands. And I've spent 3 decades watching the same preventable pattern repeat. Patients who did everything they thought was right, who followed the instructions on the bottle, who took what their doctor said was okay for short-term use and turned it into long-term harm. Today I'm going to tell you what nobody took the time to explain to them. After 60, your body handles inflammation differently. Think of your cardiovascular system like an old garden hose. When it's new, the rubber is flexible. It can handle pressure changes, temperature changes, bending and straightening without damage. But after decades of use, that same hose gets stiffer, less forgiving. The same amount of pressure that caused no problems at 30 can cause cracks and leaks at 65. Your blood vessels are that hose. And NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen and naproxen, increase the pressure inside that aging hose while simultaneously making the walls more fragile. More than 1 in 3 adults over 65 takes an NSAID regularly. Most have no idea what it's doing to their heart while they sleep. The margin for error after 60 is razor thin, and NSAIDs eliminate that margin entirely. Now let me be very specific about what's happening inside your body. This isn't abstract. This is concrete, measurable damage. Number 1, NSAIDs block an enzyme called COX-2. That sounds like a good thing, right? That's the enzyme that causes inflammation. Block it, stop the pain. But here's the problem. COX-2 also produces prostacyclin. Prostacyclin is what keeps your blood vessels open and relaxed. When you take an NSAID, you're not just blocking pain. You're blocking the signal that tells your arteries to stay wide. The result? Vasoconstriction. Your blood vessels narrow. Your blood pressure rises. Not dramatically, not in a way you'd feel, just 3 to 5 points. But after 60, when your vessels are already stiffer and your kidneys are already working harder, that 3-point rise is enough to tip you from controlled hypertension into uncontrolled, from stable to dangerous. And here's what makes this particularly insidious. The blood pressure rise from NSAIDs is cumulative. Day 1, maybe your systolic goes from 132 to 135. You don't notice. Day 7, it's 138. Day 30, it's 142. Your body tries to compensate, but the NSAID keeps blocking the compensatory mechanisms. By month 3, you're looking at consistent readings in the 145 to 150 range. Your doctor increases your blood pressure medication. You keep taking the ibuprofen. The cycle continues. Meanwhile, your heart is working against increased resistance with every single beat, 24 hours a day, 7 days a week. Over time, that chronic increased workload leads to left ventricular hypertrophy. Your heart muscle thickens, and a thickened heart is the first step toward heart failure. I had a patient, I'll call her Linda, who came to me with what she thought was fluid retention. 68 years old. Former school teacher, sharp mind, gentle spirit. Her ankles were swollen. She was short of breath walking upstairs. She'd been taking ibuprofen for her arthritis for 6 years. 6 years. 3 tablets a day, exactly as the bottle allowed. Her cardiologist had never connected the dots. When I reviewed her chart, I saw her blood pressure had been creeping up steadily over those same 6 years, from 130 over 80 to 155 over 92. Each time, her medications were adjusted, but nobody asked about the ibuprofen. I took her off the ibuprofen and switched her to acetaminophen. Within 3 weeks, the swelling was gone. Her blood pressure dropped 12 points. She didn't need the diuretic anymore. The first thing she said to me was, "Why didn't anyone tell me this 6 years ago?" Write that down. If you're taking ibuprofen or naproxen daily, or even several times a week, and you also take blood pressure medication, you need to ask your doctor this exact question. Could this NSAID be making my blood pressure medication less effective? That question could save your life. Starting tonight, track how often you're reaching for that bottle. Not next week, tonight. Number 2, NSAIDs damage your kidneys, and your kidneys control your blood pressure. This is the part most people never hear. Your kidneys aren't just filters, they're regulators. They decide how much sodium and water stays in your bloodstream. When your kidneys are healthy, they keep your blood pressure balanced. But NSAIDs reduce blood flow to the kidneys. Over time, especially after 60 when kidney function is already declining by about 1% per year, that reduced blood flow causes scarring, chronic kidney disease. And once your kidneys can't regulate sodium properly, your blood pressure rises permanently. Think about what's already happening to your kidneys at 60. You were born with about 1 million nephrons in each kidney. Nephrons are the tiny filtering units that do the actual work. By age 60, you've lost roughly 30 to 40% of them. Just from normal aging, the remaining nephrons have to work harder to compensate. They're already under strain. Now add an NSAID. The NSAID constricts the blood vessels feeding those overworked nephrons. Less blood flow means less oxygen. Less oxygen means cellular damage. And damaged nephrons don't regenerate. They scar. Once they're gone, they're gone. Here's the mechanism. NSAIDs block prostaglandins in the kidneys. Prostaglandins dilate the blood vessels that supply the kidneys with oxygen and nutrients. Without them, the kidneys go into survival mode. They hold on to sodium to maintain blood flow. More sodium means more water retention. More water retention means higher blood volume. Higher blood volume means higher blood pressure. It's a cascade, and it's silent. You won't feel it happening. The risk compounds if you're on a diuretic. Diuretics tell your kidneys to dump sodium in water. NSAIDs tell your kidneys to hold on to sodium in water. You're giving your kidneys conflicting orders. The result is that the diuretic stops working. Your doctor increases the dose. The NSAID keeps blocking it. Your kidneys get caught in the middle. And slowly, over months or years, they fail. I've seen patients go from stage 2 chronic kidney disease to stage 4 in less than 2 years, all because nobody asked them about their over-the-counter pain medication. Let me ask you something. Do you know your kidney function number? It's called your GFR, glomerular filtration rate. Most people have no idea. If you're over 60 and taking an NSAID more than twice a week, you need to ask your doctor to check your GFR and your creatinine. Write that down. Those two numbers will tell you if the painkiller is quietly destroying the organ that keeps your blood pressure under control. The fix here is straightforward. If you need pain relief for chronic issues like arthritis, talk to your doctor about acetaminophen. It doesn't affect blood pressure. It doesn't harm your kidneys. Or ask about topical NSAIDs, gels and creams that you apply directly to the joint. They deliver the anti-inflammatory benefit locally without the systemic cardiovascular damage. Give it 2 weeks and check your blood pressure daily. You'll see the difference. Now this next one surprises people every time. Number 3, NSAIDs double your risk of heart failure. Not heart attack, heart failure. Those are not the same thing. A heart attack happens when a coronary artery gets blocked. Sudden, dramatic. Everyone knows what that looks like. Heart failure is slower, quieter, deadlier. It's when your heart muscle gets too weak to pump blood effectively. Fluid backs up into your lungs, into your legs. You feel tired all the time. You can't lie flat at night without gasping for air. You wake up needing to prop yourself up on 3 or 4 pillows just to breathe. NSAIDs cause heart failure through 2 routes. First, they increase your blood pressure, as we've already discussed. Higher pressure means your heart has to work harder with every single beat. Think about it. Your heart beats roughly 100,000 times a day. If each one of those beats is pushing against increased resistance, that's 100,000 extra units of work. Every day. Over time, the muscle thickens, trying to keep up. But a thickened heart muscle is a stiffer heart muscle. It can't relax properly between beats. It can't fill with blood the way it should. That's diastolic heart failure. The heart becomes a stiff, inefficient pump. Second, NSAIDs make you retain sodium in water. More fluid in your system means more work for an already struggling heart. It's like asking someone to run a marathon while carrying a 50-pound backpack. Eventually, they collapse. The data is clear. A study published in the British Medical Journal followed more than 10 million patients. Those taking NSAIDs had a 19% increased risk of hospital admission for heart failure. 19%. And the risk was highest in people over 65, people with existing high blood pressure, and people already on diuretics. If you check all 3 of those boxes and you're taking ibuprofen daily, you're playing with fire. Richard, the patient I told you about at the start, checked all 3 boxes. He had high blood pressure, he was on a diuretic, and he was 63. Nobody told him that the combination was lethal. Nobody connected the dots between his morning ibuprofen and his evening heart failure symptoms. By the time he came to me, he needed IV diuretics just to breathe. We got him stable. We stopped the NSAID, but the damage to his heart was permanent. His ejection fraction, the measure of how much blood the heart pumps with each beat, dropped from 55% to 38%. That's the difference between living independently and living with severe limitations. Richard can't play tennis anymore. He gets winded walking to his mailbox, and all of it started with a painkiller he thought was harmless. Does any of this sound familiar? Have you been taking ibuprofen or Aleve for months or years because it works, because it's over the counter, because nobody told you to stop? You're not alone. But you need to know this. Your heart doesn't have unlimited reserve. Every day you take an NSAID is a day you're asking your heart to work harder while simultaneously cutting off the support systems it needs to function. Two more items after this one. And item 4, that's the one that even I had a significant blind spot about for the first 15 years of my career. Stay with me. Number 4, NSAIDs increase your risk of atrial fibrillation, AFib. This was the surprise for me. I knew about the blood pressure risks. I knew about the kidney risks. But AFib, that connection didn't get serious research attention until about 10 years ago. And now the evidence is overwhelming. AFib is an irregular heart rhythm. Instead of beating in a steady, coordinated pattern, the upper chambers of your heart, the atria, quiver chaotically. When that happens, blood pools in the atria instead of flowing smoothly into the ventricles. Pooled blood clots, and clots that form in the heart can travel to the brain and cause a stroke. More than 1/3 of all strokes in people over 65 are caused by AFib. It's not a minor condition. Here's the mechanism. NSAIDs cause inflammation in the heart tissue itself. I know that sounds paradoxical. Anti-inflammatory drugs causing inflammation. But it's true. NSAIDs alter the balance of prostaglandins in the heart muscle. Some prostaglandins are protective. They keep the electrical signals in the heart stable. When you block those, the heart's rhythm becomes unstable. Add in the increased blood pressure from NSAIDs, which stretches the atria and makes them more prone to fibrillation, and you've created the perfect electrical storm. A Swedish study followed nearly 80,000 people. Those who used NSAIDs had an 18% higher risk of developing AFib compared to those who didn't. The risk was dose-dependent. More ibuprofen, higher risk. Longer duration, higher risk. And here's the part that kept me up at night when I first read it. The increased risk persisted for weeks after stopping the NSAID. Your heart doesn't immediately recover. The damage lingers. If you've ever felt your heart skip a beat, or race for no reason, or flutter in your chest, especially if you're taking an NSAID regularly, that's not anxiety. That's your heart telling you something is wrong. The question to ask your doctor, write this down. Could my NSAID be triggering arrhythmias? Should I get a Holter monitor to check? A Holter monitor is a wearable device that tracks your heart rhythm for 24 to 48 hours. It catches irregular beats that a standard EKG in the office might miss. If you're over 60 and taking NSAIDs and you've noticed any rhythm irregularities, you need that test. The fix is the same. Stop the NSAID if you can. Switch to acetaminophen for pain. Or talk to your doctor about targeted therapies for inflammation that don't carry the cardiovascular risks. Turmeric with black pepper, for instance, has anti-inflammatory properties without the heart risks. Give it 4 weeks. Let your heart reset. And number 5, NSAIDs interact with your other medications in ways that multiply the danger. This is the one most people never think about because they assume their doctor or pharmacist would catch it. But here's the reality. Your doctor sees you for 12 minutes, twice a year. Your pharmacist fills prescriptions. Neither one has the full picture of everything you take, especially over-the-counter drugs like ibuprofen that you buy without a prescription record. If you're on a blood thinner like warfarin, NSAIDs increase your risk of bleeding, stomach bleeding, brain bleeding. Both drugs affect platelet function. Together, they're exponentially more dangerous. If you're on an ACE inhibitor or an ARB for blood pressure, NSAIDs block their effect. Your blood pressure medication stops working as well. If you're on a diuretic, as we discussed, NSAIDs counteract it and damage your kidneys at the same time. If you're on low-dose aspirin for heart protection, adding an NSAID actually blocks the aspirin's protective effect. You think you're protected? You're not. I had a patient, I'll call him Tom, 71 years old, on warfarin for AFib, on lisinopril for blood pressure, on a diuretic for fluid retention. He started taking naproxen for back pain. He didn't mention it to his doctor because it was over the counter. 2 weeks later, he was in my ICU with a gastrointestinal bleed so severe we had to transfuse 4 units of blood. His INR, the measure of how thin his blood was, had spiked to dangerous levels. The naproxen had amplified the warfarin. He almost didn't make it. The question to ask your doctor: I'm taking these medications. If I add an over-the-counter NSAID, what are the risks? And then actually list everything you take. Prescription, over-the-counter, supplements, everything. Because your doctor can't protect you from an interaction they don't know is happening. I want to be honest with you for a moment, not as a content creator, as a surgeon. I have stood at an operating table at 3 in the morning holding a heart that was swollen, stiff, barely able to squeeze out enough blood to keep the brain alive. I have spoken to families in waiting rooms at dawn, families who had no idea anything was wrong when they said goodnight 8 hours earlier. In case after case, the contributing factors were not mysterious. They were NSAIDs, diuretics, blood pressure pills, all interacting, all prescribed or purchased separately with good intentions. These are not exotic risk factors. They are the background noise of millions of ordinary medicine cabinets. And that background noise, accumulated pill after pill, day after day, year after year, destroys hearts. I want to tell you about Richard again, the patient I opened with. After we stabilized him, after we got the fluid out of his lungs and adjusted his medications, I sat down with him and his wife. I explained what had happened. I showed him the studies. I walked him through the mechanism. He looked at me and said, "I took it because my knee hurt and I wanted to keep playing tennis. Nobody told me it could do this." That question has stayed with me. It's a big part of why I make videos like this one. 6 months later, Richard's ejection fraction improved slightly. Not back to normal. It never does once the damage is that severe. But he's alive. He's managing. He switched to acetaminophen and topical creams for his knee. He still plays tennis, but only once a week now, and he takes breaks. He monitors his weight daily to catch fluid retention early. He checks his blood pressure every morning, and he tells everyone he knows about NSAIDs. He's become an evangelist for this information because he wishes someone had been one for him. Let me summarize what we've covered. Number 1, NSAIDs raise your blood pressure by blocking the signals that keep your blood vessels open. Number 2, they damage your kidneys, the organs that regulate your blood pressure long-term. Number 3, they double your risk of heart failure by increasing the workload on your heart and causing fluid retention. Number 4, they trigger atrial fibrillation, an irregular heart rhythm that leads to strokes. And number 5, they interact dangerously with the other medications millions of seniors take every single day. Which of these risks do you recognize in yourself or someone you love? Tell me in the comments. I read every single one. There is someone in your life, a spouse, a sibling, a friend, who is taking ibuprofen or naproxen right now and has no idea it's quietly damaging their heart. Send this to them. That one share might be the most important thing you do today. Every week I bring you honest, evidence-based information that I wish every one of my patients had access to long before they needed surgery. If you want more of that, subscribe. One last thing, and this is important. Everything I've shared today is based on published research and my clinical experience as a cardiothoracic surgeon. But your situation is unique. Your history is individual. Before changing anything, any medication, any supplement, any routine, please talk to your own physician first. That conversation is not a formality. It is the whole point. Better information, better conversations, better outcomes. That's the chain that matters. Your heart has been working for you every single minute of every single day for 60, 70, 80 years without ever asking for anything in return. Give it this. Take care of your heart.